purpose of this podcast is to educate listeners about the
Now, we are talking about tips and safety.
Some people often take the medicine without the knowledge.
Hi everyone, I am Marnal.
I'm Nika.
And I'm Rohana.
And welcome to our podcast. We're here to discuss the nitroglycerin medication.
Before anything, Marinel, what's the purpose of this podcast? Why are we making this?
Well, the purpose of this podcast is to educate listeners about the uses of nitroglycerin. We will also discuss the potential dangers of nitroglycerin and how to safely handle it, Nika.
I see. So to our viewers there, you will gain knowledge about this medication.
Nitroglycerin is a medication used to treat chest pain and heart failure. It is available in both generic and brand name forms, with the brand name commonly known as Nitrostat. It is a vasodilator.
What is vasodilator, Mar?
Well, at the root, vasodilator means it works by widening the blood vessels and improving blood flow to the heart, thus reducing the chest pain.
Oh, got it. How about the category or the class of nitroglycerin?
Nitroglycerin is categorized as an anti-anginal medication, and it is used to help treat and prevent episodes of chest pain or angina. It is also used in the treatment of heart failure to reduce workload on the heart and help it pump more efficiently.
That's just the introduction, guys. I already learned a lot. How about the viewers?
Now we're talking about the mechanism of action.
Ataru, can you explain how the medication works in the body by using simple language?
Sure, Mar. One way to think of it is like a garden hose. When the garden hose is turned on, water is able to flow freely through it. However, when the garden hose is twisted or kinked in some way, the water is unable to flow freely and the pressure of the water builds up. Nitroglycerin works like a garden hose. It helps to widen the blood vessels and allows more blood to flow to the heart. Just like the garden hose allows more water to flow through it when it is unkinked.
So in summary, it's like nitroglycerin works by widening the blood vessels and allowing more blood to flow to the heart, which helps to reduce the chest pain associated with angina.
You got it right. Another common scenario of nitroglycerin application is with a patient experiencing chest pain caused by angina. The patient takes nitroglycerin as prescribed, and the nitroglycerin helps to relax the arteries and increases oxygen flow to the heart. This helps to reduce the chest pain and improve the patient's overall condition.
How about the dosage form of nitroglycerin, Ataru?
Nitroglycerin is available in a variety of dosage forms, including tablets, capsules, sprays, patches, and ointments. The most common dosage form is a tablet that is taken orally 3 to 4 times a day, usually 5 to 6 hours apart. It may also be taken sublingually under the tongue or vocally between the cheek and gum. Sublingual and vocal nitroglycerin tablets should be taken only when the chest pain or other symptoms occur.
Oh, another learning. Another question, Ataru. How do you take or use capsules, sprays, patches, and ointments?
The capsules and sprays are taken sublingually, and the patches are applied to the chest or arm. The ointment is applied to the chest.
Let's talk about the side effects and precautions of nitroglycerin. The potential side effects of nitroglycerin include headaches, dizziness, lightheadedness, flushing, and a rapid or pounding heartbeat. It is important to be aware of these side effects and to keep track of any that you may experience.
If you experience any of the following side effects, you should seek help, medication, attention immediately, like chest pain, irregular heartbeat, fainting, difficulty of breathing, swollen ankles, or a rash. Additionally, you should seek medical help if you experience any of the side effects that are more serious or that last a long time.
I 100% agree to seek medical attention immediately because Marinel, people doesn't put that as their priority. They just set aside the idea of being sick.
True, Mika. So to everyone, always seek medical attention as needed.
Now, we are talking about tips and safety.
I guess this is the important part of the topic, to learn how to use this medication safely.
Right, Marinelle, because some people often take the medicine without the knowledge of the tips and safety. Anyway, go on, Mika.
Are you guys ready? So here are the 8 tips and safety for the patient taking these medications. So first, be sure to take your nitroglycerin exactly as prescribed by your doctor. Second, do not change the dose or frequency of your nitroglycerin without consulting your doctor. Third, always carry your nitroglycerin with you and keep it in a cool, dry place. Fourth, do not drive or operate machinery while taking nitroglycerin. Fifth, do not take nitroglycerin if you are taking certain medications that may interact with it. Sixth, if you have chest pain, take 1 to 2 nitroglycerin tablets as prescribed by your doctor. 7. If chest pain persists after taking nitroglycerin, seek medical attention immediately. 8. Contact your doctor if you experience any side effects or have any question or concerns about taking nitroglycerin.
Well, in conclusion, nitroglycerin is an effective medication for certain types of chest pain, high blood pressure, and heart-related issues. It is important to consult with a professional about the potential risks and benefits of using this medication. Taking nitroglycerin as prescribed by a doctor can help improve quality of life and overall health. We encourage everyone to speak with their healthcare provider to understand if nitroglycerin is right for them.
Wow, I couldn't believe we host a podcast.
This is one of the best experience. You know how I love speaking in front of everyone mixed, and by doing this, sharing knowledge is overwhelming for me.
Ow, I know Marinelle, I feel like I'm crying. Joke, set aside, I hope you guys learned a lot as much as we did. How about you, Ate Rube?
Likewise, Mika, as a host in our podcast, it feels like we gave enough knowledge for our viewers and listeners.
It's a wrap, guys. Thank you for the cooperation, Mika and Ate Ru. And to our viewers and listeners, we hope to provide a comprehensive overview of this important medication and its uses. Thank you for joining us. Goodbye.